So I'm just going to start with this premise that the global market for ultrasound is limited primarily by the need for a skilled operator. And if you're not familiar with ultrasound, this concept may be hard to understand. But raise your hand if you're a current user of ultrasound. Okay, so we have a handful of people in the audience, which is a perfect depiction of the current situation. A handful of people in the world use ultrasound, and everyone else is a current non-user limited by the skill required. We currently have found small size, which was thought to be the prohibitive factor. So people took these giant machines, coned them down to smartphone-style devices, and thought, I can now supply the world with ultrasound, but the user difficulty is still there. And the cost has also come down. But even if we gave these away for free, many people would be unable to use ultrasound to benefit patients. Here's why. Here's a conventional 2D ultrasound image. How many people know what this represents? It's a slice through a liver, but the orientation is only revealed by the blue dot. We lack orientation. We lack the ability to convert this slab-like image into a 3D volume to reconstruct and understand the construct. That gap right now is filled by an operator who needs months, sometimes years of training so they can acquire exactly the necessary 2D slice at the moment that they're interacting with the patient. If they can't, the patient must return for more imaging. So it's a major limitation of the use of ultrasound. Why is 3D so important? Here's that slice. Here's a 3D image, which gives us the ability to reconstruct in any plane we desire to answer questions that might not have even occurred to us at the moment we're taking the pictures. We're separating two tasks, image acquisition and image interpretation, and 3D volume acquisition is essential to that function. Our technology takes any 2D ultrasound machine, pairs it with a small chip like that in your smartphone that tells you the orientation relative to the patient's body, and then pairs it with our proprietary software, enabling that 3D reconstruction to happen all at a very low cost. We've taken this through a series of steps from a concept funded by the Coulter Foundation, an international patent, GE and Emergency Medicine Foundation grants, and then startup funding, and our first commercial enterprise with Planet Innovation, which I'll discuss in some more detail. So here's this concept again, a 2D image, incomplete, without orientation, and with no reconstruction capability, and here's the output from our system. Now we've got a block of digital tissue which we can cut into, just as a surgeon might handle that, or a radiologist, and just like a CT scan, we can see not only the entire 3D volume, but any plane through that entire segment in any orientation that we wish. We've tested the concept of operator dependence because, again, this is central. Can I equip an unskilled operator with our technology and allow them to get the same images that a skilled operator would obtain? This is a 23-week fetus we imaged with our system, and in a larger study, we showed that novices could acquire and interpret images with the same accuracy as a highly trained operator. In addition, the acquisition time is very fast, and the reason is this. With the conventional 2D approach, the sonographer needs to spend time on the patient with the transducer to capture all of the planes of interest. This can take 20 or 30 minutes, sometimes longer. In our case, we grab the entire digital volume and then offload the tasks of interpretation and finding those planes to a later point. So this actually serves another important purpose, which is to improve the patient experience by shortening the ultrasound exam time. In addition, we need highly accurate measurements out of ultrasound. Imagine the case scenario of monitoring a mass for growth or recession in the face of chemotherapy. We need to know whether that mass is getting bigger or getting smaller, and we can't be off by 10 or 15 or 20%. In our comparisons, our method yields error less than 4% compared with gold standard. In conventional 2D measurements with geometry makes too many assumptions and leads to error in those estimates. This all comes together to show us how the world of ultrasound could be expanded to all those other users. And we actually were approached by a company out of Australia saying they had a large pharmaceutical company, one of the world's leaders, interested in using ultrasound to monitor a therapy for patients at home with low-skilled operators. Our technology connected with their need, and that's our first commercial application. We also are seeking not only diagnostic improvements, but procedural guidance improvements. So here's an example of central venous catheter placement. These are large IVs placed into vessels such as the internal jugular vein, which neighbors the carotid artery and the lung. About 5 million of these are inserted in the US annually with a high complication rate. And what are the complications? Damage to the carotid artery, stroke, pneumothorax, and death. And we see these with some frequency, even with 2D ultrasound, which is known to be one of the innovations over the last decade that has improved patient safety. Our vision is to improve this 3D guidance, or this method with 3D guidance. To bring the applications together, we see expanding the use of ultrasound through telemedicine. If a person in a remote clinic with minimal skill can obtain the same high-quality image data set transmitted to an expert anywhere in the world, that opens the vast diagnostic potential of ultrasound to a huge untapped market. In addition, those 3D data sets are ripe for machine learning in order to automate the tasks of image interpretation. And so those two innovations are really primed to synergize with our technology. We have a funding round that we've gotten through our partner in Australia, and that takes us through 2020, and we're seeking to develop additional commercial prototypes and additional funding for larger scale trials. So thank you.
Okay.